Obsessive compulsive disorder, OCD, definition. Obsessive compulsive disorder, OCD, is a mental health disorder that affects people of all ages and walks of life, and occurs when a person gets caught in a cycle of obsessions and compulsions. Obsessions are unwanted, intrusive thoughts, images, or urges that trigger intensely distressing feelings. Compulsions are behaviors an individual engages in to attempt to get rid of the obsessions and/or decrease distress. Obsessions. Obsessions are thoughts, images, or impulses that occur over and over again and feel outside of the person's control. Obsessions are typically accompanied by intense and uncomfortable feelings such as fear, disgust, uncertainty and doubt, or a feeling that things have to be done in a way that is just right. Compulsions. Compulsions are repetitive behaviors or thoughts that a person uses with the intention of neutralizing, counteracting, or making their obsessions go away. Treatment. 1. Cognitive behavioral therapy, CBT. 2. Exposure and response prevention, ERP. 3. Medication. 4. Consult doctor.